Morrison's pouch. And when there's a fluid collection, even though a little fluid, still it can be visible over here. And this is right kidney. So this is Morrison's pouch. Okay, we need to see the fluid here. And beside this, if you see fluid collection, this is lower pole. Fluid collection here, only here, that is actually the paracolic gutter on the right side. Paracolic gutter. And if there is a huge collection of fluid, then you will see the fluid above the liver and below the diaphragm. Okay, if you see liver, and you will see this is diaphragm, okay, and this is fluid above the liver. The diaphragm is here. So this is diaphragm, and this is liver, and this is ascitic fluid. This fluid is under the diaphragm, we call it subdiaphragmatic, and above the liver we call it also suprahepatic. Okay? And if it goes around the lungs, if the metastasis goes to the lungs, so we might see fluid in the pleural cavity. So sonographically, can we see the pleural cavity? Yes, we can, that you know already. So, and we can see the ascitic fluid in the pleural cavity. Okay, but I can show you the pleural cavity. So, pleural cavity fluid. This is SAS view, okay? This is right lobe of the liver. And this is diaphragm. Let me put in the different color. This is diaphragm, and above the diaphragm, if you see, this is the lung area. Above the diaphragm, if you see the fluid collection, it would be in the pleural cavity, and this is the ascitic fluid. And that fluid you can see in sagittal view and also in transverse view. So this is fluid in pleural cavity or pleural sac. Okay, and this is liver. Okay, so I showed you all areas that may have fluid collection in ovarian cancer. I will draw the primary ovarian cancer and before I draw that, I will give you the tumor types, cancer or malignant primary cancer in the ovary. Okay, so you got that. Let me take this out. Okay. Tumor types, the ovarian cancer. Primary ovarian cancers, tumor types. What are the types of the primary cancer of the ovary? Number 1, Cystadenocarcinoma. Cystadenocarcinoma. See, this is the cystic version of the adenocarcinoma. So adenoma is a benign version, and there is a cystic version of the adenoma. We call it cystadenoma. And this is the cystic version of adenocarcinoma. We call it cystadenocarcinoma. And this is also two types. One is serous cystadenocarcinoma and mucinous cystadenocarcinoma. Serous cystadenocarcinoma, mucinous cystadenocarcinoma. The serous that make up the bulk of the ovarian cancer is approximately 40%, and they have the appearance of a thick walled unilocular cyst. Most of the time, if you can see it in the ovary, most of the time unilocular. Okay, and if you see, the part of the ovary is here, and this is all cancer cysts that found in the ovary, that wall is thicker. But in benign cyst, mucinous cystadenoma, serous cystadenoma, their wall is thinner, usually less than 2 millimeter. And serous cystadenocarcinoma, so this is the cystic area of carcinoma, and this is the wall, and this is ovarian part. Mostly it is unilocular. Unilocular means one cavity. Okay, I'm trying to make it more darker. Okay, so this is anechoic or sonolucent. Okay, so you're going to see it, and it could be bigger, and it is unilateral most of the time, but it could be bilateral, 10% like that. and the mucinous cyst adenoma is approximately 12% of the cancer, and these tumors can reach size of 20 to 30 centimeter. So that means it's such a big one. Okay, this is inside the ovary, and now you don't see the ovary. It's such a big one. It could be 20 centimeter to 30 centimeter, and these are internal septation. And the cellular debris, thicker wall, usually greater than 2 millimeter. Okay, and multiple septation, internal septation, and it is filled with fluid, and the dirty fluid. Okay, I'm just drawing a little with anechoic, okay, like that, and it's filled in with the fluid. Okay, so now how can we differentiate sonographically? But that is not confirmed. Confirmation is by biopsy. Sonographically, we need to measure, we need to see it is uniloculated or multiloculated. Is there any septation or no septation? Is there any debris, internal echoes, or no debris, no internal echoes? And the wall thickness that we can measure, if it is less than 2 millimeter, then mostly it is serous Cystadenocarcinoma. And if it is greater than 2 millimeter, it could be mucinous Cystadenocarcinoma. Okay, so that's the Cystadenocarcinoma. That is 2 types. And now number 2, Endometrioid tumor. So these tumors comprise say 10 to 20% ovarian cancer, and they have a complex solid appearance. Complex solid appearance. Okay, and if you want to see it, okay, your job is just to describe the characteristics, and the doctor will do the biopsy, and this is doctor will do the biopsy, and the result will come, and they will see it is a malignant or benign. Okay, endometrioid tumor, because this cells is kind of looks like endometrium. Okay, that is endometrioid tumor. Okay, maybe originated from the endometrial substances, endometrial tissues. Okay, and the next one is a solid teratoma. Okay, solid teratoma. Let me take this part out. Solid teratoma. Before we read it, there is a cystic teratoma. Okay, dermoid cyst in the ovary, and that was the most common benign ovarian tumor in the young age group. Okay, and the solid teratoma is solid, and you know the teratoma is a germ cells tumor. Okay, and unlike the cystic teratoma, this tumor is highly malignant. Okay, highly malignant, and it is a germ cells tumor. Cells tumor comprises approximately 10% of the malignancies. 10%. And it appears hyperechoic. It is hyperechoic because of the multiple different structures found inside the tumor, because is the different derivatives are there. There might be some bones, solid materials of fat, sebaceous gland, hairs. Okay, a lot of things can be there. Hyperechoic, well defined, solid mass. Hyperechoic, well defined solid mass with no enhancement. With no enhancement, because there is no liquid part here, and rather it can make the shadowing. They are rarely bilateral. Although the other ovary frequently contain a benign dermoid. Rarely bilateral, although the other ovary may have a benign cystic or benign dermoid cyst. Okay, and this is not a good news. One ovary has a malignancy and other ovary has a benign dermoid. They are destroying the ovaries, so fertility is poor for this patient. Okay, so this is solid teratoma. Sonographically, how does it look like? Okay, so this is solid. Sometimes it is brighter here, followed by shadow. No enhancement. Okay, so this is, if I want to give a little brightness, okay, so this is the solid teratoma. You're gonna see the loss of architecture of the ovary. Ovarian architecture is lost. Okay, so this is solid teratoma, and this is ovarian follicle. You can see this. Okay, and this is a germ cells tumor, as we know that. And the next one is Germinoma. This is an interesting tumor. And 1, 2, 3, 4, yes. Sorry, it will be 4. Germinoma of the ovary. It is a counterpart of the seminoma of the testis. Seminoma is the most common malignant tumor in the testis, and in ovary there is no seminoma because there is no seminiferous tubule. But dysgerminoma from the germ cells tumor and is abnormal proliferation. So it is a tumor. This tumor is a rare. So rare germ cells tumor. It occurs in children and young women. And young woman. And it is a complex solid mass. And it is the female version of the seminoma of the testes. Female version of the seminoma of the testis. So it is also a germ cells tumor and complex solid mass. How does it look like? If this is a ovary and okay, so this is dysgerminoma. Ovary. So sonographically we cannot pinpoint that this is dysgerminoma, but the other things, young children, complex looking, and the hypoechoic complex mass, and is rare. So it will be taken out and sent for biopsy, and the result will come as a dysgerminoma of the ovary. There's another one called clear cell tumor. Clear cell tumor, because the cells under microscope that found in this tumor is transparent, nothing inside, like empty. That's why it's called clear cell tumor. And this is could be 5% of ovarian carcinoma, and it is a large cystic mass. Large cystic mass, and varies in appearance from a simple cyst to a complex cyst. Varies in appearance. It could be simple to complex. Cystic mass. Okay, and this is not a germ cells tumor. So far we get the germ cells tumor are solid teratoma, dysgerminoma, and now I am giving the last one, that is choriocarcinoma. So, okay, if you want to see the sonographic image, if this is the ovary, you might okay, and this clear cell tumor can be big enough, big enough. Okay, let me make it's a cystic mass. Okay, and the last one is the choriocarcinoma. This is also a rare germ cells tumor. Number 6. Choriocarcinoma of the ovary. Just understand, choriocarcinoma, that means it comes from the chorionic cell. It's an aberrant placental cell that gives rise the carcinoma, just same as choriocarcinoma of the testis. Okay, so this choriocarcinoma is a rare germ cells or germ cell tumor, and it origins from aberrant placenta. Aberrant placenta means like an ectopic placental tissue. A non-pregnant patient will present